Welcome back, and you are tuned into News and Views, where we, of course, educating you on the many different situations happening as far as COVID-19 is concerned. Today, joining me on the line, I have Dr. Angelique Cotzee. She's the chairperson of the South African Medical Association, and she's going to talk to us about the situation on the ground. And, as you know, prior to the talk by President Cyril Ramaphosa last night, there was, of course, a call for tougher lockdowns, and it has happened, and the reason being it is actually getting out of control. A very good morning to you, Dr. Angelique Cotzee. Thank you so much for joining us on News and Views this morning, and for taking your time out to, of course, educate us about the situation out there.
Good morning, and thank you, Novisa, and thank you for asking Salma's opinion this morning.
Yes. We always value the opinions from people like you, because the thing is, it makes us understand better what we're heading for and how to deal with it.
Yeah, what can I say? We asked for level 2 and we got level 3, although it's adjusted level 3.
I don't know about you, Dr. Angelique, but I was quite surprised because everybody asked me and I thought, now we're going into level 2. And then, President Ramaphosa, of course, talked about level 3. But let's unpack it and talk quickly about what it means from the health point of view, from that particular perspective, because I know, the pressure's mounting. Things are getting rather out of control in the health sector as far as helping people is concerned.
Yeah, it's true. It's true what you're saying. So the fact or the reason why we kept on asking that there should be a lockdown or a ban on social gatherings, or even reducing the numbers of social gatherings, the amount of people attending those gatherings, is because we know that these social gatherings create super spreaders for us. And this new virus, we're talking about the 501.4V2 variant. At this stage, what we have seen is it attacks anyone from the age of 20 upwards, and not as in the first wave, predominantly the elderly people and the people with high blood and cholesterol and sugar. So this virus are very contagious. It spreads very fast. So what happens now during the festive season? South Africa is notorious for their abuse of alcohol, that it would normally be during this time of the year. So we used to that. We use that to the fact that our festival seasons are creating much more alcohol and drug-related trauma, as well as motor vehicle accidents. And then you see your normal heart attacks and stroke coming in. But now, during this time, we also are now struggling with the COVID-19 surge and the steep incline of numbers and people needing health care and or admission into the hospital. So now you're sitting with a problem of beds. So you can have enough beds. And I think this is something that is being misunderstood out there. There's a lot of beds at this stage. What there is not is a lot of hands. And that's doctors and nurses. So there's not a lot of hands. So you need to prioritize. And if we can just curb a bit the influx of our alcohol-related trauma incidents that we are seeing, it will help us to look better after the COVID and the other emergency patients coming into a facility. You need to understand that by curbing the alcohol, we hope that it will, the steep incline that we are currently seeing will be a bit less steeper. I don't think we're going to have no COVID patients coming in anymore. The alcohol is not going to take away the COVID patients, but it's trying to relieve the pressure on the healthcare system. And anyone working in a casualty this time of the year know how difficult it is when a drunk patient comes in with a stab wound. They're sometimes very abusive. You are under a lot of pressure. The nursing staff is under a lot of pressure. Then you have to deal with abuse as well, while you know that there's other people that's extremely sick. And it just becomes an emotional roller coaster for doctors and nurses.
Interestingly, that you spoke to me, about the less hands, and I think that's the what we wanted to bring to the fore, is that the hospitals, what's happening, due to the interaction of the nurses and the doctors with the patients, and as you're saying, this virus is a whole lot worse than the first one. It's highly contagious. It's a lot more than what it was in the beginning, and the doctors and the nurses are also getting it. So what's happening is you're getting less hands there, and the situation is getting more dire as the days are going by.
Yes, you're absolutely spot on. So, I need to say that all over the world, the hospitals are having, a huge burden of these, or the same situations, maybe not in the way that we are seeing our alcohol-related incidences, but, regarding the numbers of COVID. But what is unique to South Africa is that in our healthcare system, in the public sector, we've got moratoriums on existing posts. It's just unbelievable, but there's moratoriums. So no one is employed to help alleviate the pressure. So you've got a skeleton staff working this time of the year. And remember, SAMA already started in October warning that we will see our second wave during the festive season. We were very clear about that. And some people were quite, they didn't like us saying this and said, well, how can we say that? But we say it, we say it based on what, we're all doctors. We know what is happening. We know how people behave.
And it's about bringing the facts to the fore so people could actually be prepared for this and take the necessary precautions. But if you really look at it, that really didn't happen.
Exactly. So now we have to camp down on especially on a total ban of alcohol, a total ban of of young people going into hotspots where we know that they will be infected, because we are not a nation known for their willingness to adhere to rules. I call it the Band-Aid method that we are having with these short lockdowns that we are getting. And with that, I mean, there's a deeper underlying problem. There's an underlying problem of failure of the healthcare system, especially in the public sector. There's a failure of getting our people in this country to behave when they take alcohol in a responsible way. So if we do not address the deeper problems, we will keep on doing this Band-Aid. And we're quite sure there will be a third wave after the second wave. So and if nothing is still happening, we will do the same Band-Aid method that we are doing now, not really helping our country and our people to get better behavior.
I so agree with you. And I think the better behavior is to be able to just take those precautions and follow the rules that have been given out. Because literally it's about saving lives and wanting to change the situation and try and flatten that curve in some way so that we don't actually go through a third wave. Because what's happening is it's so difficult to try and create that balance between trying to save the economy and trying to save lives.
You're absolutely, again, correct. It is extremely difficult, to do that balance. And if people just listen, it's not a lot that we're asking. I call it a mantra. It's so simple. We ask you, wear your mask, and the mask, I'm going to show you, should be like this, over your nose, not like this, not like this.
And the reason I'm laughing is because we walk in, into so many different spaces, and that's exactly what you see. So that's really defeating the purpose of trying to curb the situation.
Exactly. You're not curbing anything. You're just adding to the problem. And I know it's not easy to wear a mask. For the average person out there, especially the elderly people, I see them. They struggle to wear it, but they're trying to wear it. And so for them, I'm always saluting them because they're really trying. But there's another age group that, there's no, I don't know whether it's an entitlement thing or whether they think nothing is going to happen to them. I don't know. That's behavior. It's mind-boggling. Because for 8 months, we have said day in and day out, your radio station, everyone was, say the same thing every day. And then 8-9 months later, we still don't have ears to listen. So what do you do?
But I think this lockdown has come at the right time. I think it's given us a chance to be able to understand how dire the situation is. I mean, having to been taken from 1 to 3 says a lot. It talks a lot about the type of situation we're in and how dire it really is. And I mean, if you look at the hospital situation, I just spoke to an NPO not long ago, just before I spoke to you, and they're talking to me about their ambulance services and how dire needs there are for oxygen tanks. I mean, we seem to be running out literally of everything. So how are we going to save lives if we ourselves, and I think, as President Ramaphosa says, I think it starts with us, we ourselves. We need to start being responsible. So now it's coming from the individual point of view.
Yeah. There's a lack of responsibility, but again, also there's a lack of accountability. So, if I don't do it, nothing is happening to me. I don't see that I actually infect my grandmother or my dad or my mother, because I don't feel the disease. I don't see it. So only when they test positive and the rest of the family then tested positive, then everyone wants to know where it's coming from. But actually the young people going into these nightclubs and where there's a lot of young people sitting around without their mask, they are actually the super spreaders and without feeling it. And there needs to be an accountability. I'm not sure whether it's the right way to criminalize the fact that you don't wear a mask. That might be taking it a bit far in the case of that we know that our law enforcement doesn't really have the capacity to take on another criminalization of people not wearing masks, throwing them in jail or taking them to to the courts. We simply don't have. That's another department that doesn't have all the manpower. So we need to come up with something that's more practical to make people understand if you do not wear your mask, ABC is going to happen to you. And then it must happen. Because, again, we are also a country who loves to talk. We're always busy talking. And we have these in Davos. And we have this in, a lot of things. But do we do it at the end of the day? No, it's not happening. The practical things is not happening.
Dr. Cotzee, I have a question for you. There's something that I noticed, and I want to bring this to the fore because I really do want our listeners to understand the situation and what needs to be done. A lot of them say, oh, okay, my friend over there, I'm having a chat with them, is not wearing a mask, but I am, so I'm safe. Is that true? Because to me, I would say that is a myth in inverted commas.
No, I'm now at the broomstick length because it seems people doesn't understand what is social distancing or personal distancing. So if you can put a broomstick between you and your friend, preferably outside, not between four walls, you might be much more safe. If it's between four walls, you have to open all the windows. There should be no aircon on. And then you have to be 1.5 meters at least away. And you should not cough. You should not sneeze, because we know it's a heavy droplet, and it have difficulties in traveling fast. But if you sneeze and you cough while you are speaking to your friend, you are in the way if you don't wear your mask.
Right. One quick message before we go. We seem to have run out of time. What quick important message do you have for all of us?
It's simple. Do the mantra. Wear your mask correctly. Stay away from other people. Be outdoors. We've got this beautiful country, but people are not outdoors. We have to be outdoors. And I would like to thank the people who's really, really doing their utmost best to adhere to the rules. I thank all the healthcare workers. But there's lots of work to be done. And if you're not responsible and you are sick yourself and you end up in casualty and there's no doctor, do not ask where the doctor are. We have warned you about lack of doctors.
But we want to commend you, all of the health workers out there, all the frontline workers, including yourself, going out there and giving it your best to try and help people like us that are out there. So we really want to commend you from myself and the team. Thank you so much for going that extra mile. We take our hats off for you and say thank you so much. But we wish you and pray that you do stay safe and take care of yourself. From myself and the team, thank you so much. We wish you
Thank
a
you
very
so much. Thank
we
you,
wish,
guys.
we wish you a very good day. Take care. Bye bye.
Bye.
Dr. Angelique Cotzee, of course, from the South African Medical Association, giving us some valuable information on keeping safe during this difficult period. We're going to go for a quick break. We'll be back with you in a sec.